I'm glad you said that, Sean, because West Virginia, Huntington, is a blue-collar area, right? People working physically.
I understand what we're talking about in filling a void, but I really have to agree with the doctor, because in West Virginia, it's a blue-collar world. Timber, coal, rail, steel. When people get hurt on those jobs, they can either go to rehab, or they can have surgery, or they can find a doctor, especially in the coal fields, who say, take a few of these and you'll be back at work in a couple of days. Let me give you a stat. 1 year, West Virginia, a population of 1.8 million, was prescribed 780 million opioid pills. I mean, you have to be a genius to see that. You're talking about hundreds of pills for every man, woman, and child in that state. That's too much. And it was done simply as an easy way out. So now a lot of cities, communities, and especially states are filing lawsuits against these big pharmaceutical companies, trying to recoup the money for all these health benefits that have been spent. The same thing you saw in big tobacco in the 90s. And indeed, a very powerful man has joined this fight, the former Attorney General in Mississippi, Michael Moore, who really took down big tobacco. So I think that is where this is going. This is going to be the next big step in the story.
And Matthew, you have this sort of...
Well, there is...
Sorry, go ahead, Marisa.
Oh, no, I was just going to add that there is no doubt that the FDA is one of the biggest drug pushers around these days. However, I'm just speaking from my own experience, having been an addict addicted to heroin. That's just been my experience, and speaking with other addicts as well. So
yeah, I'm glad you brought up the FDA, which is the Federal Drug Administration here in the US, which sort of licenses these drugs, because you have one opioid which is perfectly legal, and then you have one that isn't, which is heroin. And I understand there was a confluence of events. The heroin started coming in through very sophisticated networks into the US in the late 80s and 90s, just as actually the opioid prescriptions were coming down, that some doctors were learning about the addictions. So heroin filled this void. How did that feel in a DEA sort of point of view?
Well, see, again, the laws weren't allowing us to really focus on heroin the way we were crack cocaine. Those were the issues. Cocaine, going after these dealers. So we sort of put that to the side. And then what happened was one day we looked up and we saw that, okay, this is a real crisis. This is a problem. Had they made the laws against opioids, heroin, fentanyl, those things say we had made the laws the way we were for crack cocaine early on.
You could have got a handle on the crisis.
I think we would have had a much greater handle on the crisis, especially from a law enforcement perspective.
Well, it certainly took the country by surprise, because now we have this huge problem that is trying to be addressed by the new president. I mean, he ran on this, Donald Trump, and won votes in areas that he may not have always won votes in as well. New Hampshire, for example. Dr. Kolodny, he's declared this a public health emergency, the new president, Donald Trump. Is he doing everything that he's promised to do? Will this finally get the US ahead of this crisis?
Unfortunately, all we've had from President Trump on the opioid crisis has been talk. Last August, he announced that he believed the opioid crisis was an emergency, and yet did not follow up that announcement with any plan of action or request for funding. And then just a couple of weeks ago, again, he announced that this is an emergency. He gave it a special public health emergency designation, but he hasn't yet sought funding from Congress to address the crisis, and he has yet to put out any plan. So all we've really received from President Trump on the opioid crisis has been quite a bit of talk. If I can just add, though, in terms of the relationship between prescription opioids and heroin, heroin use has been rising rapidly from the beginning of the prescription opioid crisis in 1996. Younger people who were becoming opioid addicted, once they got addicted and they needed to be on a large supply on a regular basis because they were hooked, younger people, healthy-looking 25-year-olds, have a hard time getting a large supply from a doctor every month. So they wound up on the black market. The pills are very expensive on the black market. So they switch to heroin because it's much cheaper. And we've seen heroin move into more regions of the country where it wasn't previously available to meet the demand for it by this growing number of young people who became addicted to prescription opioids and then switched. But we do have an older group of Americans who've become opioid addicted, people in their 40s up through their 90s. That older group does not need to switch to heroin. That older group after they become addicted to prescription opioids, they don't have trouble finding doctors who will continue them on large quantities on a monthly basis. So the older group has been dying of overdoses involving the pills. The younger group has been dying of overdoses on heroin. And in the past couple of years, in that younger group, overdose deaths are soaring because the heroin supply increasingly has fentanyl mixed into it.
I got your logic. I want to go to Marisa in a little bit about her experience, but let's just talk about the administration first. Sean, you were shaking your head a little bit. I mean, we're all journalists, you know, but you study this very closely. And Dr. Kolodny has actually put a price tag on what Donald Trump should do. $6 billion a year, I think it was, over 60 billion over. I mean, that's a lot of money. Is that what's needed, do you think?
Yeah.
And both gentlemen.
I've never met the doctor, but I've read a lot of what he's written.
Yeah,
and
he's very good.
I can tell you I agree with virtually all of it. And everybody I've talked to, because I've followed this story very closely, what Trump did is kind of a toothless pledge. It doesn't even come close to addressing this. There's no money. You need recovery programs. Once you get into opioids, it rewires your brain. It's unlike any other drug, so it's very difficult. And Marisa can talk about how hard it is to get off. People, the people who go back, it's like 90%. You need to make it a national emergency if you listen to people who talk about this, because it needs to have funding. In West Virginia, sadly, one of the cottage industries that's popped up are recovery centers that are popped up all over the place. But you have to have that. There's so many ways we can go down the path on this.
Sean, thanks for bringing up Marisa, because Marisa, is that your feeling too, that heroin is a very difficult drug to kick, and you need all the resources of obviously the state and the federal government, and of course friends and family around you?
You do, and unfortunately, I think that so many people are making money off of the problem on both ends, whether it's the drugs being sold to the insurance companies, to these recovery centers. So I feel that because there's so much money being made off of the problem itself, I don't necessarily feel that people are going to be so willing to make the problem go away. And that's why I think it's so important, if you are an addict trying to get clean like myself, is really to surround yourself with people that are going to support you, and to really recreate those personal networks that when you're using really dissolve and are non-existent. So it's about how can we recreate family units? How can we recreate society that will support an addict going through recovery? And I actually created a film called Grace that was on the festival circuit. And that's what I wanted to do with the film, was to start a conversation about recovery. Because everybody talks about the problem, and yet not a lot of people talk about what the solution can be. And I think it's so important that we kind of reach our hands out to those that are really struggling, just to sit and listen, because there is so much pain behind the addiction, and there is so much sadness behind that addiction as well.
We were playing.
So I think that also is a start.
Good. We were playing the film you were talking about that you wrote and were in and directed, and we encourage people to reach out and have a look at that. Do you agree with that from the...
Yeah, but one of the things that you definitely got to put the resources into it. You know, that's just a hollow words if you not put the resources into it. The other thing is, I was with an organization called Law Enforcement Against Prohibition. We were totally against just the war on drugs altogether, because we realized that was something that no matter how many drug dealers or people we took off the street, it increased. The violence continued because it was in a black market. So our whole opinion on this thing was, look, you can't police your way out of this. You have to regulate it the same way you would any other drug, alcohol or whatever.
And the Trump administration are trying to police their way out of it as well.
And it's just not going to work. All we're going to do
You don't think it's going to work?
I don't think it'll never work trying to police your way out of it. You have to give it medical treatment. You have to look at it from that perspective. Because law enforcement officers, we on the street, we are not medical personnel. So we deal with you differently. You'd have to retrain us all over again how to be medical folks who can actually deal with this problem. My job is to go out and enforce the law and to lock you up.
Because you do realize that what's happening at the moment here in Washington is they are not giving extra money, but they are giving longer sentences. That's the way they're going.
Right.
So you're saying that approach is totally wrong.
That's right. Because you're filling up the prisons the same way you did with crack, cocaine, and all these other drugs. You just filled the prisons up. What they did with alcohol prohibition, they said, it's not working. Let's end it, and let's train people, and let's get people to educate the folks, get them to understand. Now, going after the companies or the folks that supply and demand, go after those folks, yeah. But in the little guys, the guys on the street, the people that we're going after, you got an addiction, you sell something here and there, even the laws of where you might sell fentanyl or something that causes somebody's death. I can understand law enforcement stepping in that said, if you give somebody drugs that cause their death, you're going to face 20 years in prison. But just the overall picture for law enforcement altogether, it's just, to me, it just doesn't work.
You say that you're not first responders, but actually in your film, Sean, often they are.
Yeah.
First responders do come along and are actually trained now in dealing with addiction and overdose.
Absolutely. Correct? And first responders for some time now, and Dr. Kolodny can talk more about this, have carried a drug called Narcan with them everywhere they go. And when we went out with the police officers in Huntington, West Virginia, it sadly didn't take long. They responded to a call of an overdose. We went to front porch, and there was a guy, no heartbeat, no nothing. They hit him with Narcan, and he sat up. And it wasn't like the dramatic Pulp Fiction where they jump up and gasp. He was in a fog. He came out of it, and the authorities, by that time the EMTs were there, and they told him, look, you have overdosed. We've given you Narcan. You can either stay here or come to the hospital with us. We recommend you come with us because the Narcan doesn't last as long as the heroin, and you could fall back into an overdose. But one thing that I'd like to pick up on what you talked about, it's kind of like the elephant in the room, okay? Crack cocaine was sold in urban areas.
Yeah.
And opioids, a lot of faces that overdose are white. And Dr. Kolodny, I think, wrote, and I may be overstating this, but I don't think so. He wrote that, look, a lot of doctors were really hesitant to prescribe opioids to African Americans, to Hispanics, thinking they would misuse them. So,
But it's across, and also white people are mainly affected in a lot of rural areas, is what you're trying to say as well. Dr. Kolodny, I want to talk about the marketing of opioids, because you've written a lot about this. A lot of people have written a lot about this recently. There's this term, opioid phobia, that apparently doctors had in the 60s and 70s. They're basically worried about prescribing opium. How did these pharmaceutical companies, and there's not many of them, but they pushed pretty hard, get over this reticence that the doctors that Sean was just talking about? And what are they doing now, considering there's such a crisis?
Yeah, you know, I don't believe that doctors were suffering from opioid phobia in the past. That was the messaging. When you put the word phobia at the end, what that means is that there's an unrealistic fear.
Right.
So the notion that the medical community was suffering from opioid phobia, an unrealistic fear of getting their patients addicted, that was a message that came indirectly from the pharmaceutical company and led to an explosion in opioid prescribing and played a role in creating the epidemic that we're here facing today. Opioids are very good medicines for easing suffering at the end of life, and they also play an important role when used for a couple of days after major surgery or a serious accident. Unfortunately, the bulk of the prescribing in the United States is not for end-of-life care or a couple of days after major surgery. The bulk of the prescribing is for common chronic pain conditions where opioids are more likely to harm the patient than help the patient. And it was that brilliant campaign that encouraged the medical community to use these drugs long-term that led to where we are today.
I'm glad you mentioned this sort of marketing campaign. You know, opioid phobia is part of that. I was just imagining, can you try selling it to China in 1836 and saying, you know, opium's fine, guys. And we saw the lesson there. But it is happening, isn't it? It is being rolled out across the world. We've got some tape here. This is a Spanish language commercial. They've used stars in countries like Spain and elsewhere to sort of say, ask your doctor about pain. Are we seeing, as the market sort of dries up a little bit here in the US because of the lawsuits and the controversy and the federal government reaction, new markets sort of come into play? Dr. Kolodny, quickly.
Yeah, that's exactly what's happening, and that footage that you may have is very similar to the campaign that led to overprescribing in the United States, and it's been effective. Prescribing is increasing in Western Europe and Central Europe and in Asia, and now there's Oxycontin in China, which is very strange. Does China really need Oxycontin? There's a role for morphine to treat people at the end of life with cancer pain, but does China need Oxycontin? It would concern me.
Sean, you want to say something?
Also, I'm interested in what the doctor has to say about pain becoming the fifth vital sign, because that's something that came out. If you've been to the doctor recently, they may have the sad face on one side, the happy face. And say, on a scale of 1 to 10, where's your pain? And people don't really understand what they're talking about when they answer that, and it kind of gives the physicians carte blanche to write these opioid prescriptions.
I'd like to obviously talk to Marisa a little bit more. If you were sitting in the White House today, perhaps you should be, what advice would you give the president and his team? Remember, he had a high-level team with Governor Christie of New Jersey. That's just wrapped up its work. What would you advise them to do?
Well, I think that some of the money can be spent on education. There's so many children that are growing up in schools. We never learn how to deal with our feelings. We never learn how to deal with our emotions. It's only after the fact, once someone has become addicted and finds themselves in rehab, where they're sitting in therapy sessions and they're learning how to process anger, process guilt, process sadness. And there's so many things that happen growing up in childhood that can put someone in a position to want to not feel those feelings. And I think that if there's some money invested in education on how to do that in the public school system, that would be a huge help. Because I know for myself, I was bullied as a child.
Right.
If I had learned at that time, and of course this is before all the anti-bullying campaigns that we have today, but if I had learned at that time how to deal with my feelings of low self-worth, not feeling confident, sadness, anger, I might not have reached for that first drink to make myself feel better, which eventually led me to using heroin.
Marisa, thanks so much.
So I think that there is
sorry, we're going to have to cut you off there, but
sure.
I think you're really right about saying that, you know, the one good thing from this is perhaps the stigma of addiction can be lifted once and for all. That was just such a great panel. Unfortunately, that's it for this edition of The Heat. I'm Nathan King in Washington, D.C. Thanks so much for being with us. See you again.